Hello, my name is Christian Meyer from Düsseldorf, Germany. I'm an associate editor for JACC, and we are here in Boston at the Society's annual heart rhythm meeting. And I'm glad to be here with Vivek Reddy from New York. And we're going to talk about some recent insights regarding the safety and effectiveness of pulse field ablation for atrial fibrillation in patients with heart failure. This was an analysis from the Manifest PF multi-center registry. Mm-hmm. Congratulations to you and all the other investigators, and thank you really for doing this pioneering work. It's a great opportunity, but we all know that something like this is also coming with challenges, so really thank you. Anyway, would you tell us about the findings from this analysis, Vivek?
Sure. So the Manifest PF registry was a registry that we initiated that captured the initial experience with pulse field ablation when it was approved in Europe back in 2021 approximately. And we received patient level data. We aggregated it from 24 different centers, everyone consecutively who was receiving pulse field ablation with the pentaspline pulse field ablation catheter. And in this analysis, it was approximately 1,500 patients, so a good number of patients. What we presented today, and actually was presented by my colleague, Dr. Mohit Turagam, also from Mount Sinai. So what he presented today was a heart failure substudy of Manifest PF. And so the quick background, as we know, is there have been a number of publications over the past several years that show that in patients who have atrial fibrillation and heart failure, particularly HFrEF patients, that if you eliminate the atrial fibrillation with catheter ablation, you see improvements in outcomes, not just in patient outcomes, which is of course very important, but also clinical outcomes. So because of that, there's been a lot of interest in, let's say, ablating atrial fibrillation in patients who have heart failure. The difficulty is that traditionally these procedures have been very difficult to do. There's fluid load that can happen with our ablation catheters. So even though this is something that we think is very interesting and will help our patients, it wasn't always performed because of the technical issues. Along comes pulse field, where the procedure is much quicker, there's no fluid load, much better tolerated by patients. And so what we wanted to understand is there reason to be optimistic? And so we looked at the Manifest PF registry, and we separated into three cohorts. There was the no heart failure cohort, so no history of heart failure, and then the heart failure cohort, which we further subdivided into the HFrEF population and the HFpEF population. And we looked at the outcomes and compared between the groups. What we saw was that basically on the effectiveness side, the HFrEF and the HFpEF patients, the success rate was a little bit lower than the no heart failure patients, but it was still quite reasonable. Mm-hmm. On the safety side, it was a wash. There was no significant number of complications in any of the groups.
Great. And could you maybe give us some additional insights regarding safety endpoints and complications, or anything important to mention from this perspective?
Sure. There were very few safety events. In the aggregate cohort, the major complication rate was only around 1%. And by the way, this is also with operators using these catheters for the first time. Their whole learning curve, all of that was captured in this study. We now know, by the way, in the follow-up Manifest study that the complication rate has dropped even further. Yeah. The only real difference that we saw was that in the HFpEF population, mm-hmm. there was a little bit more in terms of vascular complications. Mm-hmm. I'm not sure why. I don't know if it's real or if it's spurious. Yeah. It didn't reach statistical significance. Yeah. So we'll just have to keep an eye on it. But ultimately, all the patients did well.
Great. And would you speculate about some next steps? What does it mean, especially maybe for mm-hmm. patients with preserved ejection fraction? That's a growing field of interest.
Yeah, no, absolutely. I think that there's a lot of interest in HFpEF patients, as you know, and we know that there's not that many therapies. And we also know that getting them in sinus rhythm, they do feel better, at least acutely. And so it probably will translate into good outcomes. I 100% agree. I think the field needs some randomized trials in the HFpEF population with AFib, doing rhythm control versus not. And I'm optimistic that it'll happen. I also think, by the way, in the HFrEF population, even though the evidence base there is quite strong, it may be that we still need a little bit more evidence with PF, with pulse field, since the previous studies were all done with thermal ablation.
Great. Congratulations once more. Thanks for moving the field forward. and looking forward to more things to come. And we're really happy to get this published in JACC. Thank you.
Thanks for having us,
Thanks.
and thanks for the publication.